Stem cells have abundant healing properties. They can actually adapt to tissue. We've seen it work. I'd like to share a story of a gentleman. He had shoulder issues. He could barely lift his arm 8 or 10 inches from his waist out to the side. We injected him, and I moved it around. I got some fluid moving in after the injection, got everything loosened up, and I said, try to lift your shoulder. And he lifted it up over his head. He looked at me. He put it down, lifted it up again. He said, I would not have believed this. So sometimes the pain relief can come super fast because there's properties in stem cells that really decrease inflammation, sometimes almost instantly.
Welcome to Look Good, Feel Good with Matt and Amy McKinley, the podcast where we bring you expert advice and honest, real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Hi, and welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
Howdy, I'm Matt.
And today we're diving into something we're really passionate about, stem cell therapy. This is one of our most powerful regenerative tools, and we get asked all the time, why should I choose you for stem cells? And what makes your clinic different? And so we're going to kind of dive into that today, why expertise matters when it comes to stem cell therapy, why who you choose matters, and the quality of your results really depends on really 3 things. Depends on the source of the stem cells. Number 2, the experience of the provider. And number 3, how it's delivered. So that's where Matt brings something very unique to the table. He's worked in orthopedic surgery for about 20 plus years, and he knows joints inside and out, literally. He's been inside joints, and that depth of experience is a game changer, really, when you're injecting stem cells, and you have to be very precise in the injection. So Matt, tell us a little bit about stem cells and kind of what you've seen in your orthopedic career and why that matters when it comes to stem cells.
Well, yeah, to kind of piggyback on what Amy said, I practiced in orthopedic surgery for literally 23 years. In the past 3 years, I've extended that career in the form of stem cells and helping people get better and feel better with a non-surgical approach. I assisted in literally thousands of surgeries from the shoulder to the toes, all the way down, probably most specifically knees, shoulders, hips, and then a smattering of everything in between there. So I got a great understanding through the years of experience and great mentors and teachers. I learned the anatomy. I learned how things function, what makes them break down, and how to fix it. So it was a great career in orthopedic surgery, and do I miss it? Sometimes, but I love what I'm doing more now, more than anything else. So it is very important to know where to put the stem cells precisely. And one thing that can teach you better than anything else is experience. So having the opportunity to inject literally 20s, actually we did the numbers, and probably over 40,000 injections into joints or tendons, orthopedic injuries, those types of things through my career. So a lot of that, I definitely don't tout myself as being the best, but I tout myself as having a lot of experience, and that's always the best teacher.
Yeah. And I think, you do have tons of experience, which is really awesome. So you went from orthopedic cutting into now using stem cells. So tell me why you believe in stem cells now. What is it that's changed, from surgery till now?
So yeah, for years and years, that's all we did in orthopedics was we would treat people initially with conservative measures like non-steroidal anti-inflammatory medications, corticosteroid injections, sometimes joint fluid injections. But then it was all basically teeing people up for surgery. So surgery works great usually, but sometimes it doesn't. And once you go down that road, there's no going back. I saw thousands of patients that did wonderful, and I saw, a handful, more than a handful of patients that didn't do well. And after that, there was really no going back. So it's not just about avoiding surgery, but the other drawback with surgery is there's a long recovery, sometimes up to a year. And if it doesn't go well, you're a year into recovery. And then I saw people that weren't happy.
not just about, you're right, about avoiding surgery. It's about improving quality of life. And that's kind of really what it comes down to, is quality of life. You want to improve people's lives. What makes our approach so different?
So when I trained on stem cells, I actually went to the Midwest and went to a couple of clinics and trained on different types of stem cell therapies. So the one I like and I know works the best because I've seen the results are umbilical cord stem cells from live birth C-sections, by the way. These are not taken from abortions or anything shady. That was super important to me to know that. These stem cells are donated and they come from live birth C-sections, so they're very pure in nature, okay? Stem cells have abundant healing properties. They can actually adapt to tissue. We've seen it work very consistently in joints and tendons like knee joints, hip joints, shoulder joints, and also soft tissues like rotator cuffs, like tennis elbow tendons, like ankle tendons. So all of those things work better. But what I do is I customize each treatment plan for each individual. So it's not a cookie cutter program. It's based upon injury, the diagnosis, imaging, looking at x-rays and or MRIs and knowing exactly what's going on before a plan is made, and also understanding the anatomy.
Yeah.
Because that's a huge part of it. There's a lot of places out there, and I'm not throwing darts at anyone, but they start doing stem cells and they really don't even know where they're injecting. In fact, a quick story, when I went to a clinic in the Midwest, they brought me out and traded my services in basically teaching or instructing their practitioners how to inject. In trade, I learned their stem cell programs. And I was shocked at people that were injecting that really had no clue where they were putting it or how to do it.
Yeah, I think that's a big thing. People are on the internet or on social media are injecting joints that have never injected joints before. And I think you really need to do your research on where you're going. We're thankful that we have it here in the United States. So Matt, share us a story about a patient. I know you have a patient that, avoided knee replacement because she came in and she was scheduled for knee surgery, for a total knee replacement, because that's what the doctor said. It was bone on bone. And, she came and saw Matt, okay, I'm going to just try this and I'm just going to see if it works. Tell us the story about the female that came in.
I actually met her at a health fair, which I really didn't want to go to, but I did anyway. I twisted my arm and ended up being a great experience. But I met her there and she said, hey, I'm signed up for a total joint replacement. And it was I saw her in November and she was scheduled to have it done in December. And so she goes, what do I have to lose? I'll come in and just listen. So she came in, we sat down, talked about it. She said, I don't know, I'm skeptical. And I said, well, I certainly never try to push anyone towards anything because I want everyone to know it's always their choice, their ability to make the decision. And she said, I want to try it. I don't know if it'll work. So I have a protocol where I do 2 treatments. I learned this through trial and error, but we did her first treatment and she came back 2 weeks later and said, I'm feeling better. And then later we did her second treatment and she came in for follow-up and said, I just called and canceled my total joint surgery. Later on that season, actually it was in February, there's a wrestling tournament here in Idaho at the Holt Arena, which is a big dome that has steep steps. She came in to our clinic and said, I just carried my 3-year-old grandson up and down the steps all day and my knee did not bother me. She was really amazed, but that's one story that's been awesome. Another one, I'd like to share a story of a gentleman who his daughter actually referred him because she had stem cell treatments and done well, but he comes in and he kind of looked at me and said, I'm skeptical again. I don't know if this is going to work. And he had shoulder issues. So he was really, if you can see this on video, he could barely lift his arm, maybe 8 or 10 inches from his waist out to the side. So he goes, well, I'll try it, but if this doesn't work, I'm just having surgery. So we injected him, and my sister was with me. She's an RN. Her name is Kara Walker. Shout out to Kara. She's awesome. But this was in Twin Falls. We injected him, and I moved it around. I got some fluid moving in after the injection, got everything loosened up, and I said, try to lift her shoulder. And he lifted it up over his head. He looked at me. He put it down, lifted it up again, looked at my sister and said, "You've got to be shitting me." He said those exact words. And he said, "I would not have believed this." So anyway, sometimes the pain relief can come super fast because there's properties in stem cells that really decrease inflammation, sometimes almost instantly. So that was a cool experience. He's about 6 months out now, doing great. He's been super
it's
happy.
It's nice that you have these longer cases that have done well even through time. Is there any sports related cases that you've had? I mean, younger adults.
Yeah, so it's amazing. And you parents that hear this, you're going to know this is true, that parents spend a lot of money on their kids these days for training, for specific personal trainers and so forth. There's sometimes scholarships online. So I saw a volleyball player that is scheduled to go to college and on a scholarship, by the way. She's amazing. About 3 inches taller than me. She was sitting in a chair and stood up, and I was like, whoa, you're pretty tall. Really neat lady, neat young lady. But anyway, she had a small labrum tear in her shoulder. And what the labrum is, it's basically, it's like a suction cup to the ball and socket of the shoulder that keeps it in place. And if it tears, it can become very painful, especially with an athlete who is hitting a ball very forcefully. So anyway, we did her first treatment. And she was also doing a course of physical therapy, which I recommend. But we did her first treatment. She comes back and says, "I'm 70% better." I was like, cool. Well, let's go for 100%. So we did her second treatment and follow up after that. She told me she had been back doing open gym, preseason stuff for volleyball, zero pain in her shoulder. So that was another really amazing story.
It's pretty amazing. When you start doing it and you start like actually getting the patients coming back and hearing their stories and the results they have, it's been kind of fun and amazing to see it. It's not just a one size fits all approach. Every patient is very different. We take the time to evaluate your history. Matt looks at the imaging, looks at the pain pattern, determine the best course. We treated everything from chronic knee pain, rotator cuff tears to degenerative disc disease, and even TMJ. I've had some experience with TMJ. I've had it personally, and we're going to have to talk about TMJ in a later episode about how stem cells help with TMJ.
Yes, that has been shocking how well it's worked. For those of you that suffer from TMJ or know someone that does, this is your gal right here.
It's been fun to see the results. We've seen patients cancel surgery. We've seen 70-year-olds walking without pain again. For many, it's just like the first time they've gotten true relief without medications or downtime. And it's not magic. It's the body healing the way it's supposed to when given the right tools. So if you're wondering whether stem cells, are right for you, or you're just, want to work with providers who actually specialize in this, we'd love to talk with you.
Yeah, I'm super passionate about this because of the outcomes that we've seen, the results. You can't argue with results. I'm not a big believer in studies that you see on the internet because they can be manipulated. So I will only speak of the results that I've had. And honestly, to me, it's been super amazing after all of these years in orthopedics to see something that works that doesn't require surgery. It's been phenomenal.
Yeah. So thanks for tuning in. Next week, we're going to dive into how hormone balance impacts your mood, your energy, and mental health. So don't miss that one. Thanks, guys.
Thank you.